This is another YouTube video on therapy in my therapy series. Um, and first of all, I guess I should introduce myself. I'm Dr. Mark Carriage, as I'm bringing the slideshow, and I have produced a video series on therapy, and this is part four of the therapeutic process. Communication, because it's all communication and assumptions of communication, which help define what communication thing is. So before I get started, this is for adults. It's for adults that are in mental health, excuse me, but that are in the mental health field, uh, per se, because I use a lot of psychobabble, like we like to talk psychobabble to each other, and it's kind of hard to follow if you don't really have the understanding of it. So moving on. Again, to re-announce myself, I'm Dr. Mark Carriage. I've been around for at least 45 years. Got my bachelor's in 79. I'm truly dyslexic because I started in 76, finished in 79. The bachelor's degree in psychology from SIU Edwardsville. Then went on to get a master's in counseling, 81, St. Louis University, and a PhD in counseling, 85, St. Louis University. So I think I spent like 9 years in school. At any rate, I then from and at the end of that time, I finished up my coursework and got into a counseling psychology internship at Texas Tech University from 1984 to 85. You can call me Dr. Mark. I've been working in the prison system for 40 years, just in perhaps in different variations. Retired from the state with 27 years in 2012. Only retired to take another position at running a sexually violent predator program in Farmington, Missouri. So, when I'm also taught at the local universities and etc. I will say before I get into anything else, if you want you want my CV or any other info, including these PowerPoints or any other PowerPoint I may have, email me at mcarich@aol.com. Yes, I'm on AOL and I still have a flip phone, by the way. Okay, so jumping back up into it, I had the privilege and honor to travel with my father in the early 80s to a couple different workshops. Um, the American Society of Clinical Hypnosis workshops and conferences um, were enlightening, to say the least, because I met the best in the world of that era. Except I just missed Dr. Milton H. Erickson, but I did different his different students, colleagues, co-workers, co-professionals, whatever. Um, and then I want to also say that people have invested in me professionally. Therefore, I want to give back to a certain extent. So I'm currently working for Chad Welch in the Metro East counseling private practice in the Metro East of St. Louis. For folks that aren't familiar with St. Louis area, and we're in Swansea, Illinois. I'm also doing some consulting with TCI, which is located in the East St. Louis Metro East area as well, Cloquia Heights, as we're revamping a program for youth. Okay, so with that, all that said, let's move on. Again, this is for adults that are in the field. So, what are we going to talk about today? A lot of different stuff. In this particular show, we're going to discuss the therapeutic process because it's all involves communication, conversation, if you will. So, we're going to look at some basic assumptions of communication and therapeutic process, and maybe some things to be aware of as we're going along in the overall process. So, what's the essence of therapeutic communication. Really, it's all communication. So what are we talking about here? Let me start out with I love constructivism and social constructivism. Really, the postmodern grasp of that is really suits my fancy. At any rate, and Epictetus, I'm sure I just slaughtered his name, but the Stoic philosopher, and Albert Ellis had quotes him a lot, famously said, "We cannot choose our external circumstances, but we can always choose how we respond to them." And that was the central, well, one of the centrals besides the holistic view of Adler. Adler actually um, bought into that viewpoint um, probably around 1900, even though he was the in the early 1900, he was the prince of psychoanalysis. He was already rethinking his thinking, and so he had a constructivist viewpoint. So no matter what kind of crap happens to you, you can always choose something to respond to it, whatever which way you want. So what's a holistic view of self change in life? Well, start with self and change. There's self and change can be demarcated, subdivided, if you will, to interacting experiential domains, which produce the experience. So, what am I talking about? If you haven't seen my other slideshows, and I didn't put it in this slideshow, again, be happy to send you the PowerPoints on it. But it could, the experiential domains include cognitive, which is thinking, emotional, which is feelings and related, um, behavioral, which is observable motor actions, physical responses, if you will. Um, I included spiritual, which is defined three different ways, really. The meaning of your life is one. What is it all about? How do you look at yourself? Two, a connection with a higher power. Three, just the viewpoint of that there's more out there than just me. So anyway, that's kind of a holistic view, and everything's interconnected and connected at multiple levels, which is the next thing. So therapy is all about change. Now, change occurs at multiple levels. The therapy is a process. It is a process. Yet the therapist delivers interventions in the form of communication, and the client responds back. Um, Comments that one is that I could take anybody's individual, family, group, dog, whatever kind of session you got going, and tell you exactly the type of interventions you're using. So again, it's all communication. And why does constructivism play such a large role? Because we all we construct our inner realities. So constructivism is key. And then social constructivism, we form co-realities. So what's a therapeutic? In the therapeutic context, the therapist and client interact and form co-social constructed based on the session and the process. So with that said, we all have our own viewpoints. It's just that, unfortunately, some people in the mental health field really don't have it mapped out too well or at all. And that's a tragedy in itself. I'm not going to get on that soapbox and be here all day. This, by the way, is supposed to be a short video. But it's the framework that our therapeutic theoretical framework provides an organized way of viewing the problem and intervention strategy. It's implicitly and explicitly how the therapist then passes the lens on to the client. And that happens, again, overtly Like when if I go through a little REBT type intervention set, what am I doing? I'm passing Albert Ellis on to them. I'm not literally, figuratively. Um, well, with that in mind, there's numerous theories and models. Therapy and change can be defined differently, but there's similar core, what I call generic, generalized structures and definitions. Also, you can be the staunchest behaviorist you want to be, but you're adding your own little unique twist to the model. Keep that in mind because you're attached to your own thinking. There are numerous techniques across the spectrum of therapy as well, and you're probably saying, well, how do you know? Well, I do know because I've taught classes on it. I've been studying since 1984, and we published a training manual collecting a whole bunch of different techniques across the spectrum. I did try to label them in categories, more trying to be in the more experiential domains, but I had to get out of that a little bit. At any rate, that's for another discussion, maybe at some point in time. Um, the point is that it's all interventions that creates the process with the client responses to the interventions. So, what is communication? Simply an exchange of information, behaviors in a specific context. Therefore, the therapeutic communication is an exchange of sequences of communication, like we like what we like to call it, the form of interactional patterns between the therapist and client in a change context. The context does involve implicit, explicit rules. Implicit, or let's start with explicit, is here's the rules of therapy. Some therapists will have the client sign an agreement, a contract that they're going to abide by the rules, especially if you play in group. Um, but implicit is this is how we kind of interact. This is what's going on. It's it has specific goals, therapeutic goals, which involves the change on the client's part. It's what really the client comes in says XYZ is the problem, or I don't know what the problem is. Can you help me figure out what the problem is? And you find out what the problem is, and that's the content. The process is the interactional process at one level. At another level, it's the experiential domains that are firing off for the client's experience. Okay, so communication is central to therapy. It's all conversations, it's all processes involving communication, it's all the exchange of information, energy, etc. It's all about the connection or relationship between the client and therapist. Now, um, we like to call it the alliance. Okay, some assumptions and more of a meta, which is a higher level generic therapeutic view across spectrums, of course. Um, the process involves influencing the influence between the therapist client based on communication, conversation. The basic communication, again, exchange of information in the form of behavior and energy. We have to add energy to that context because there is an energetic exchange going on as well, and occurs in a change context. It's not like we're playing cards, we're playing, let's do therapy, and it's in a therapy context. Now, therapy is communication. The therapist influences the process. The therapist directive at some level. Even the most nonverbal, uh, or I should say, nonverbal interventions through the most Rogerian therapist is directive. Carl Rogers was brilliant. He directed his clients through nodding, not nodding off like Carl Whitaker did in a session or two. and then generate some dream he had about the couple or family or whatever. But um, nodding in agreement, recognition, um, establishing that rapport, that connection, that understanding, if you will, that empathy. But that's all being directed at some level. He's just doing it a different way. And I'm sure the Rogerians, the hardcore Rogerians, would be wanting to shoot me at this point. But therapy, but it is what it is. Therapy is structured at some level again. It's just not namby pamby. It's structured at some level. Now, a lot of times it's based on the client's needs, obviously. It's not our needs that are being met, it's the client's needs. The therapist model, their viewpoint dictates, well, the view are at both conscious and unconscious levels. And I also mentioned there's multiple levels and dimensions of the change process itself. So the goal is to influence the client to change. I don't care how you cut the pie, it's still the pie. The client is responsible to change, so the therapist is responsible to set up the context for change. Now, you will read where, in some cases, the client is responsible for everything that goes on, and if they don't change, kick them out or forget them or kick them to the curb. Where if you read stuff like Jay Haley, where he says the therapist is responsible for everything, including the client making changes. Well, you can't force somebody to do something, um, but you can help enhance, you can help motivate them to get the point and maybe do something. Um, so, with all that said, it's based on we cannot not believe or perceive. We're always got thinking going on. We're always perceiving stuff. We cannot not communicate because we're always communicating more nonverbally than verbally. In groups, especially, or anywhere, one cannot not participate. The client's always participating. We always make choices, um, and we're constantly perceiving continuously based on our beliefs and our thinking, which may be a lot of it may be unconscious. One always communicates in multiple contexts because we're in a system and within the systems, and it's called a holon. If you follow the systemic world of definition, so we're always participating. So if the client is sitting silent, they're participating.